So what do we do to manage it? In this last couple of slides. It's like managing an infectious disease, communicable infectious disease outbreak of any other nature in dogs or cats in shelters. There's certain things that you need to have in the toolbox that are key points of a management strategy and success of that strategy. You got to do something with the sick dogs. They can't continue to remain in the general population, continuing to spread infection to all dogs around them. So they need to be isolated or moved off the premises to some other facility or foster network that can care for them. Exposed dogs. They may not be sick yet, but they certainly were exposed to the sick one, so they could be infected in sort of an incubation period and will be breaking with disease at some time in the future, so they need to be quarantined because they could be potentially infectious. Need to decontaminate the environment. If you can't completely stop intake, then all dogs that have to come in the shelter because of local ordinances need to be put in some protected environment where they're not exposed to sick or exposed dogs. Because if you don't, you're just adding more logs to the fire. The whole goal is to create a clean break between this population and new emissions without resorting to depopulation. Yes, there may be some loss of life, particularly dogs that are already sick and may be deteriorating, but the goal is not to clean house in order to facilitate a more an easier return to normal. So I'm going to use the 2008 outbreak in the Florida shelter. We knew the dogs died on these dates. We confirmed strep zoo infection in these dogs by February 6th. Very rapid confirmation of infection by strep zoo, starting with the initial dogs that died that were shipped to us for diagnostic testing. We confirmed the concurrent canine flu and canine respiratory coronavirus infection in dogs throughout the shelter 2 days later. So we knew by diagnostics what we were dealing with. So to follow the principles of management, the sick dogs were moved to the that were still in their stray hold period were isolated in one wing of the stray hold kennel. And if they were still sick and getting progressively worse as their stray hold expired, they were euthanized. The exposed dogs were quarantined in another wing of the stray hold building. So now you have all the sick and exposed dogs in some portion of the stray hold building. This emptied out their adoption building because they moved all the exposed dogs out of there to the stray hold. They moved all the sick dogs out of there. And they started treatment of all the dogs on site with injectable penicillin once a day for 7 days. And this is before we knew that cefavecin or Convinia would work. But wouldn't it have been the perfect choice? So now we're talking about 350 dogs. Can you imagine how it took the staff 10-hour days to go through and inject every single dog once a day, creating great risk for spread of infection. And this particular strep zoo was resistant to doxycycline. The shelter did discontinue adoptions. Owner reclaims were released on cephalexin oral therapy and instructions for home quarantine for 10 days. So owners were allowed to reclaim their dogs, even if it was in the sick or exposed population. In addition, rescue groups were very interested in taking the exposed dogs out of the shelter, and they were allowed to do so. Again, the dogs were sent out to the rescue groups with cephalexin antibiotic and instructions for quarantine. The shelter called a temporary moratorium on acceptance of owner-surrendered dogs, which caused a sort of transient turmoil in the community, but with all the media coverage of this event, the public quickly grew to accept this as a necessity to ease the strain on the shelter. Since the adoption building was emptied, it was stripped, thoroughly disinfected, and because this was a highly publicized event, it caught the county commissioner's phone lines and attention, and they were on the news. And so the shelter director found the perfect opportunity to get the money for repainting all the kennels. And that's what that she'd asked for it for 3 years, and it took Strep to get the commissioners to say yes. We'll send people right over and do it. So once this was done, this building was used for housing of newly admitted stray and legal custody dogs they had to take in because they're a municipal shelter. And not only were the sick and exposed populations in the other building getting penicillin, but now the staff were tasked with treating the new admits too as a sort of prophylactic approach for prevention of strep zoo infection. And the veterinarian, one of the shelter veterinarians, did a cool thing. I really like this and like to pass it on to other shelters regardless of what infectious disease outbreak they're having. But she divided her animal care team into stoplight colors. For this particular outbreak, she had a red team and a green team. The stray hold building with sick exposed dogs was the red building or red zone, and the adoption building with newly admitted clean dogs was the green zone. So the respective color-coded staff were only allowed to work in the matching color zone. And they had to wear full PPE, boots, Tyvek, gloves, and they had color swatches on their Tyvek so that if people in the red zone saw a green person running around, they would report them. It was great. The staff loved it. They were really getting into self-monitoring the traffic of the staff into areas where they shouldn't be. In addition, all the supplies for each area were color-coded. So you didn't see red mops in the green zone. So I thought it was very good. The staff really could follow this color scheme. And there were no new cases of strep zoo after the initial deaths on February 6th. And the shelter was able to reopen after 10 days when the paint dried. So I thought this shelter did a very good job of managing this strep zoo outbreak and not allowing it to spread within the facility. Number one, they recognized it quickly, but it's very dramatic to see dogs in pools of blood dead in a kennel. So that shakes your attention, and it makes you pick that phone up and reach for help and say, we've got Ebola down here, which is what's circulated, believe it or not. It was dog Ebola. So I think I'm going to conclude with this. I think we have one more slide or two, but this is the distemper outbreak in the same shelter that was in 2011, and strep zoo was also found, but it pretty much was managed with the same strategic principles as the outbreak 3 years earlier, except this is the one where we finally could use Convinia. And the staff loved it. And the dogs could go out to rescue groups or owner reclaims, and they did not have to continue antibiotic therapy with the animals. So Convinia was a great savior here. Okay, so I don't know if we have time for questions. We don't know how long it persists in the environment, but it's very easily killed by the routine quaternary ammonium products. And bleach, and trifecta, and whiskey wash, and all of that would be overkill. But certainly your Rocaus and Zeps and all of those routine quats used in shelters. But I don't know how long it stays there if you don't disinfect Yes. How long are the dogs sick for? 1 to 2 days. If they don't just die suddenly without any forewarning visible symptoms, the dogs so far have had like a cough or nasal discharge for 1 or 2 days before progressing rapidly to death. Is that your question? Oh, if they're treated. If the dogs are not already in that dead man's land where they've got the severe respiratory distress and the blood from the nose, and they probably got a thorax full of blood, if they haven't reached that state, they can be recovered by treatment with the appropriate antibiotics and fluids if necessary. But it seems once they get in that really progressive state, they don't respond to therapy. They will go ahead and die. Does that answer your question? Well, if you give Convinia, it'll last for 14 days. If you use injectable penicillin, it looks like once a day of the long-acting penicillin for 7 days was effective. Cephalexin has been given orally for 10 days, as well as clavamox in other outbreaks. Does that answer it finally? Okay, sorry about that. Yes? No one knows. Obviously, for dogs and shelters, it's not coming from contact with horses or ruminants. And it's probably not being introduced by a staff member who groomed their horse the morning before they came to work. So we don't know where it's coming from. We don't know why it's virulent in dogs, much more so than in other species. It's not known.